Now, I've been a hip surgeon for nearly 25 years, so you might think that I've seen and heard it all before, but there are still lots of things that I learn when I listen to patients and try to understand how their hip problems affect their lives. Every day, of course, is a school day. Recently, one of them told me that he had no idea how tired and frustrated he'd be while recovering from surgery. He was really surprised at how swollen his leg was. I spent a lot of time telling my patients how surgery will affect them, so I was shocked to hear this. It was a timely reminder to me that I should never assume that what I've said to a patient will be remembered by them. We've all done it. You're told some important information, and as soon as you've walked out of the door, you've forgotten most of what was said. So today, I'm going to talk about leg swelling after hip surgery. In my experience, it's inevitable that you'll have some swelling in the operated leg. It starts a day or two after the operation, and it usually gets worse before it gets better. Sometimes the leg can be very swollen and bruised, and it can be quite alarming. One of the things that we worry about with leg swelling after surgery is the possibility that you might have had a deep vein thrombosis, or DVT. It's highly unlikely, as the risk is less than 0.5%, and we follow national guidelines to reduce that risk. You'll be given medications to take or inject when you get home, but it's often difficult to decide whether or not someone has had a DVT just by examining them. So if there's any doubt, we arrange for you to have an ultrasound scan, a duplex scan, and a blood test to confirm the diagnosis. So why does leg swelling happen? Well, surgery really is just a controlled injury. You get bruising and inflammation around the hip joint because of the trauma of the incision and the surgical approach. This causes the tissues to swell up, and as a result, the flow of blood and lymph, or tissue fluid, back to the heart is a bit squeezed. This causes fluid to back up in the thigh and the calf. Bruising often tracks down the tissue planes in your leg, sometimes as far as your toes. As the injury response starts to settle down, normal service is resumed and the fluids flow freely again. The bruising gradually disappears, but it can take several weeks for this to happen. The problem with swelling is it makes the leg weigh more, and the muscles, of course, then have to work harder to get things moving. This adds insult to injury because you're right at the beginning of your rehabilitation from the operation, and a heavy leg is really the last thing you need. It will get better though, I can promise you. What can you do to help reduce leg swelling? Well, rest is the most important thing. I advise all of my patients to lie down for at least an hour twice a day when they get home. This helps to reduce the pressure in the leg and encourages the tissue fluids to drain back towards the heart. You shouldn't sit in a chair for more than half an hour at a time for the same reason. Doing your exercises regularly will encourage blood and lymph flow in the right direction, and this too will help to reduce the swelling. If it's painful, take some paracetamol. After about 6 to 8 weeks, the tide suddenly turns and the swelling rapidly gets better, almost overnight sometimes. Our bodies really are amazing in this respect. If you're worried about it, then contact the hospital for advice. We'll arrange for you to be seen and have investigations if necessary. If you'd like to know more about anything to do with hip surgery, then please get in touch. The details are in the description below. Thanks for watching, and I'll see you all next time.